In Chapter 9, we're going to talk about viral diseases acquired through the alimentary and other routes. Poliomyelitis, also known as polio, is a viral infection that Dr. Jonas Salk, I'm sure many of you have heard or learned about him. He devised the first vaccination against polio. And then after Dr. Salk, Dr. Albert Sabin developed the second vaccination 6 years later, which has pretty much entirely replaced Dr. Salk's vaccination. And polio was first recognized in 1840, and the first actual epidemics were in Norway and in Sweden in 1905. By the first half of the 20th century, it became a pandemic, meaning, as you all know, pandemic means it went worldwide. When polio was first discovered or first recognized, it produced more fear in the community, in the communities that it was affecting than AIDS did back in the 80s and 90s within the world, because polio was not selective. It affected anyone just like any virus would, whereas AIDS was only and is still only an actual danger to a select segment of population. Like I said, polio was a threat to everybody, and paralysis and death were synonymous with polio. And if it was a child, then paralysis, it was called infantile paralysis. And in the early days, because it mostly affected children, then it started to become more prominent. It would affect the adults as well. And polio was symbolic of paralysis. Basically, it really would basically deform the individual's legs, and the disease itself was associated with something called the iron lung, which was a huge, monstrous armor of iron in which victims were slid into, kind of almost like our version of an MRI, and only their heads were free. And actually, it was to help the individuals breathe, because it affected their lungs as well. And this iron lung was the forerunner for what we have today as a respirator. So here's just a picture of what an actual iron lung looked like, and you could see why people were so afraid of it. It's really kind of a creepy contraption that people knew that they were going to end up in this iron lung if they contracted polio, if they would live, actually. And polio still is part of many countries are still affected by polio, and this is just a victim that you can see the deformity in his leg from the polio infection. And I can remember when I was very small that my mom was very afraid of polio and how deforming it was to people. And actually, I dated somebody when I was in my first year of college whose mother had polio. And it was very sad because she had like a big lift on her shoe and she had a brace on her leg, and she had it as a child. So I was able to, in my in my lifetime, I was able to actually see somebody who had suffered from polio. Um, the incubation period for it is 7 to 14 days. It can be as much as 3 or as little as 3 or as up to 35 days. And most contagious a few days before and after the onset of the symptoms. The virus can exist in the feces of the individual for 3 to 6 weeks longer. Most people are susceptible to this disease, and it actually, the paralytic form actually increases with age. And whenever we talk about any of these diseases, you'll notice that pretty much everything increases with age because our immune system is weaker. And also remember now, which we'll talk about in a minute, now we are using the polio vaccine routinely in childhood vaccinations. However, I'm 53 years old, and my polio vaccine was, probably 52 years ago. So as time goes on, your immunity to that vaccine lessens. There are 3 forms of polio, and its immunity type is very specific. Many years after having polio, some of the survivors developed similar symptoms that are similar to those that they had when they had the actual acute illness or the disease. And they're very similar symptoms, fatigue, pain, weakness in the muscles, and there is an actual name for it. It's called post-polio syndrome. In 1988, the World Health Organization identified polio as a disease that they wanted to have eradicated by the year 2000. So basically, they were giving themselves 12 years to eradicate polio worldwide. The goal was not met. By 1994, North and South America were certified free of the disease. But as we've discussed earlier in the semester, with cross-continental travel, nobody is really safe. So going into countries that have not eradicated the disease is very risky for individuals as to possibly contracting the disease. Polio is like any other disease. It must be eradicated worldwide in order for it not to be a threat. And that only makes sense, once again, with the concept of cross-continental travel, people immigrating into our country and bringing diseases with them. Direct contact through close association with someone that has the disease is necessary to contract the disease. So that's how you can see that it would run through complete families. And remember back in the 30s and 40s, a lot of people didn't have their own houses. They shared houses with, a lot of times, children would get married and they would move back home with their parents. When I was growing up, I think I might have told you, my grandparents were from Italy, and they had 7 kids, and there were 4 of the kids living at home with their spouses and their children. So I actually was kind of raised in the same house with a lot of my cousins. And so you can see how if it affected, just like chickenpox, if it affected one, it's going to affect everybody in the household. It's only really been within the past 30 years that you see people get married off on their own and be able to afford a house. That was a big issue back in the day, so to speak, that people couldn't afford houses. So they kind of all lived together. They took care of each other, watched out for each other. So that's how close contact polio or any bacterial or viral infection could spread so easily. Fecal oral route is pretty much the way that the individual is going to contract the disease. Poor methods of sanitation. It's considered an enterovirus, which is named for its transmission route through the intestine. Enteric means intestinal. Where sanitation is good, it is spread more by pharyngeal secretions. So the individual would carry fluids within their pharyngeal area. They would cough, or even speaking, they could transfer those respiratory droplets. The virus lasts longer in feces than secretions from the throat. And once again, just talking about, methods of poor sanitation, we in the United States are so fortunate that we have the sanitation in the public health systems and the infrastructure that we do have as far as sanitation, because so many countries do not have what we have. Hence why so many underdeveloped countries still have problems with a lot of these diseases that have been eradicated in the United States. So the 4 major outcomes of polio, the first one, asymptomatic individuals don't have any symptoms at all, and that occurs in about 90% of the polio virus. Minor illness, about 5% of the time the individual will have fever, headache, malaise, sore throat, vomiting, just kind of like a flu. The non-paralytic polio, back pain, muscle spasms, in addition to the minor illness symptoms, and that occurs about 1 to 2% of the time. And then the actual paralytic polio with spinal and or cranial paralysis occurs 3 to 4 days after the minor illness has subsided. So after the flu-like symptoms have subsided, and that's about 0.1% to 2% of the time that the individuals will have the actual paralysis. And as we said, polio prevention now is immunization beginning at 2 months of age. And adults that are traveling to high-risk areas should also be revaccinated, just for the pure, simple peace of mind that they're not going to come back with something. So the next viral infection we're going to talk about is hepatitis, and many of you have had lots of training on hepatitis B, which is has been one of the most concerning for us in the healthcare field. Now we're seeing hepatitis C as a big threat also, whereas back when I first started into dental hygiene, it was hepatitis B because they did not have the vaccination at the time, and you never really knew who was a carrier, which is kind of what's going on right now with hepatitis C. So all hepatitis actually means is an inflammation of the liver. And remember, we talked about mononucleosis, and we said that that's a side effect of mono is hepatitis and inflammation of the liver. So we have viral infections that actually attack the liver, and that's where we came up with the viral hepatitis. And there's at least, that we know of, 5 different viruses that cause hepatitis. And we start with hepatitis A, which is HAV. hepatitis B, which is HBV, hepatitis C, HCV, formerly known as non-A, non-B, which when I was when I actually took this course, how many years ago, it was still referred to as non-A, non-B. So now it's called hepatitis C. And kind of keep that in the back of your mind, as that is our biggest threat right now in the healthcare profession. Hepatitis D, which was formerly known as Delta, and hepatitis E, which is similar to hepatitis A. So please make sure that you pay attention to these hepatitises that we're going to discuss, because I think these are very important for you because they affect you every day. Hepatitis A is considered infectious hepatitis, and it is seen commonly in daycare centers in developed countries. So, like the United States being a developed country, you would commonly, if you were going to see hepatitis A, you would see it more in daycare centers because of feces and changing diapers. IV drug users, it lives on, it'll live on needles, unprotected sex. Travelers to countries where the disease is at an endemic. And we have not had an epidemic in the United States with hepatitis A since 1971. There was an increase in 1983, and that increase continued until about 1989. Humans are the actual reservoir for infectious hepatitis. However, hepatitis A has been found in chimpanzees and other non-human primates. So, we are very similar in our development and makeup to chimpanzees and gorillas and so on. So they have been found, but you won't find hepatitis A in an animal like a dog or a cat or a squirrel. You're not going to get hepatitis A from them. The average incubation period, you could see, is long, 28 to 30 days. So you could be in Mexico and been contaminated and not really get sick for a month later. It's communicable during the last part of the incubation period to a few days after the onset of jaundice. Now, not everyone will get jaundice. We know jaundice is the yellowing of the skin. Not everyone will get it. But if somebody is jaundiced, we know that whatever is causing it is active at that point. So that's why we're saying that it's going to be communicable for a few days after the onset of jaundice as well. The transmission of hepatitis A, and remember, you should really pay attention to how all these hepatitis infections are transmitted. It's, like I said early on, it's fecal-oral route. The contaminated person handles food, and the food was eaten by the next person who it was prepared for. And that's why I said fecal-oral route with daycare centers, because if you're changing a baby's diaper and you're not washing your hands afterwards and you touch something, you prepare the child's food or whatever, you stand a chance of contaminating the next person. It also can be in contaminated shellfish from contaminated water. So if the water that the shellfish has been taken out of has hepatitis A in it, the shellfish will be contaminated, and if it's not cooked at a high enough temperature to kill the virus, then the individual is going to get it. Blood route is rare, but somebody who does have hepatitis A should not donate blood. The another way, I don't think I put it in a PowerPoint, but another way is also if somebody has hepatitis A and they're eating in a restaurant that the silverware or the dishes are not washed at a particular temperature, then there have been many outbreaks of hepatitis A by the fact that the silverware is carrying the virus, and the next person who eats off that silverware is going to get contaminated. And you can't imagine a restaurant not having a dishwasher now, but think of all the third world countries. Think of going somewhere like to Mexico or Costa Rica. They don't have the same public sanitation as we do, and very common to get hepatitis A in that manner. In some of the smaller restaurants, they aren't mandated to use a dishwasher. I should take that back. It's not saying that the smaller restaurant isn't mandated. Obviously, if you have a big restaurant, you're going to have a dishwasher to be able to turn your silverware and your dishes and your clientele over quickly. But smaller restaurants, all they're required is a sanitation. It's called sanitation. It's like a pill that they put in the water. And so you can kind of see how even in a smaller restaurant, someone can get contaminated with it within the United States. There is no specific treatment. Basically, it has to run its course. Prevention, obviously, good personal hygiene. I can't stress good personal hygiene enough. Proper disposal of feces and diapers. If the individual is going to be traveling, you would probably recommend a IgM immunoglobulin shot, which basically is going to trick the body into thinking that it has already had the hepatitis A, and it should be given anywhere where there's an outbreak. If there's an outbreak at a daycare center, everybody in that daycare center should receive the immunoglobulin. Travelers going to high-risk areas, obviously, they need to. I know that if you're going to Mexico, that's one thing that they do recommend. And also, if you're going to be doing any world traveling, one thing that they do recommend that you do is contact your local health department, and they will give you a list of vaccinations that you should have in order to prevent different diseases that are prominent in different countries. Oysters and clams, other shellfish, should be heated on high for 4 minutes or steamed for 90 seconds. I myself have gotten super neurotic about eating any sort of shellfish just because a lot of times where they're catching or where they're fishing for these things are pretty dirty water, and I can't make myself eat it anymore. But if you do, like, how people eat the raw oysters, very bad, very, very bad, because if there's hepatitis A, or if they are not absolutely fresh, you are going to be one sick person with them. So, yeah, if you're going to be eating any shellfish, you're going to make sure it's cooked well. And just a little bit of information on immunoglobulin. Immunoglobulin M, or IgM for short, is a basic antibody that's produced by B cells. And our B cells are they produce antibodies in our system. And the IgM is by far the physically largest antibody in the human circulatory system. It's first antibody to appear in response to the initial exposure of an antigen. So when you have been exposed to, say, I don't know, even so talking about hepatitis A, when you've been exposed to it, the first thing your body is going to do, remember the antigen is the exposure, but the first thing your body's going to do is try and put out an antibody that's going to counteract that antigen entering your body. The spleen, where the plasmablasts are responsible for antibody production reside, is the major site of specific IgM production. So, kind of in a nutshell, when we talked about the spleen and mono, once again, we'll go back to mono, and how the spleen enlarges. The spleen is where all our antibodies in our blood is circulated through our spleen to help prevent infection. So if you have something like mono or something like hepatitis A, your spleen can become enlarged because there's such an engulfment of antibodies in blood. It's overworking to try and fight that antigen in your body. So by getting the IgM injection, your body doesn't have to work really hard to produce the antibody. We've already given it to you in the injection. So if that kind of makes a little bit of sense for you as far as the how the IgM or the immunoglobulin will work when it comes to hepatitis A. It kind of makes the body, it puts that antibody into your body, so your body doesn't have to work so hard to produce an antibody to the antigen. Okay, so remember hepatitis A we called what? Infectious hepatitis, so that's more of an infection. Hepatitis B is called serum hepatitis. It's a much slower onset. The average incubation can be anywhere from 2 to 3 months. Blood from the victim is infective weeks before the symptoms actually appear and through the carrier stage, which could be for life. So back in the day, which my son likes to make fun of me saying back in the day when I tell a story of when I was younger, but when I did first start out in dental hygiene, if somebody put that they had hepatitis B on their medical history, then that was always a phone call to the doctor to see if they were a carrier for it, because sometimes they can have hepatitis B, they recover from it, and they're not a carrier, but sometimes, and a lot of times, they can be a carrier for life. Hence, well, if you don't have your vaccination, your hepatitis B vaccine, and you'd spear yourself with a needle or in my case, a dental instrument with someone that had hepatitis B, that's blood on blood, and chances are you're going to stand a real good chance of coming down with hepatitis B as well. In fact, before HIV and before we had all these new standards in the dental office, those of you that are dental hygienists might or might not remember, but we didn't autoclave instruments. Instruments were not autoclaved. A lot of times they were just washed and put back out. And then there became a period of time where once again we had something we called a cold soak, and it was like a sanitation method where we would just drop the instruments into the cold soak for 20 minutes and then they were all good to use on the next patient. But hepatitis B patients, um, their instruments were always bagged and autoclaved. So, which, looking back on it, you have no idea who's a carrier, who's not a carrier. Same thing with HIV. Hence why we became very conscientious as far as universal precautions, because you never know who has, what someone's lifestyle is and who's carrying what disease. So the difference, obviously, once again, we can see hepatitis B, how it's transmitted, is going to be very similar to HIV, blood, saliva, semen, and vaginal fluids. Whereas hepatitis A, remember, that was more fecal oral route. So individuals with hepatitis B, contaminated needles, syringes, other intravenous equipment, in my case, instruments, dental instruments that weren't properly sterilized, can all transmit hepatitis B. Exposure to mucous membranes or sores to contaminated blood or blood transfusion. So that was another really kind of crazy thing when I first started in dentistry, was that we didn't wear gloves. And so if you had a little hangnail, or you had a little nick or something on your finger, they had these little things they called finger cots, and they looked like little mini condoms actually, and you just put one over a finger so you didn't get saliva on your sore. But if you have an open sore, or you have a little hangnail that happened to be bleeding, and you touch something that was contaminated with hepatitis B, there's a good chance that you can come down with hepatitis B if you don't have the vaccination. Also, hepatitis B was very prominent in homosexual intercourse as well as heterosexual intercourse. The symptoms of hepatitis B, remember, this can be up to 90 days. Just not feeling good, just not having an appetite. You can have abdominal discomfort, which is from the inflammation in the liver, nausea, vomiting, sometimes rash, sometimes jaundice. Not necessarily, it's not necessarily going to get jaundice, but these are all signs of it. A much higher mortality rate than hepatitis A, especially in people over 40. Once again, as as you get older, hepatitis A does not really have a high mortality rate. Like I said earlier, it's just a matter of getting over it, feeling pretty crappy, and the disease running its course. Hepatitis B, high mortality rate. The treatment for hepatitis B has been interferon, which is just a medication that's typically used for the liver. It's been shown to slow the progress in about 40% of the cases. Hepatitis B prevention is going to be the vaccination and also proper sterilization techniques. The vaccination, like I said earlier, was probably, I'm trying to think, maybe mid 80s that it came out, and then series of 3 injections, which I'm sure that most of you have had. And it used to be that you had a choice whether or not you wanted hepatitis B vaccination if you were going to be in the healthcare field. Now they really don't even give you that choice. It's an inactive virus that they use in the vaccine. It's not active like it used to be, so the risk of contracting hepatitis B from the vaccination is 0%. So we require, I don't teach in dental hygiene anymore here at Youngstown State. I used to, but we require all the dental hygiene students to have their hepatitis B vaccination before they can begin working on patients at all. And then again, proper sterilization techniques, very important. Okay, hepatitis C. Now, hepatitis C is our new hepatitis B as far as being afraid of contracting the disease, because we really don't have any treatment for it. There's no vaccine for it, and it can remain dormant for many, 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 many years before people start having symptoms. And a lot of times they don't have symptoms until they actually have cirrhosis or cancer of the liver. So we even decided that a lot of people coming back from the Vietnam War that were involved in risky sexual encounters in Vietnam, as well as IV drug use, were carrying it from that many years ago and just now being diagnosed with it. The CDC estimates that 36,000 to 230,000 Americans are infected with hepatitis C each year. Now, that's a lot of numbers. Might not seem like a lot, but it's a lot. Of those individuals, 25 to 30% have symptoms. Currently, in the United States, we estimate that 3.9 million people are infected with hepatitis C. And like I said, many have no idea that they are infected with it. And so that brings them at a risk for us as healthcare workers working with them. Groups at risk are, once again, HIV drug users, individuals that are on dialysis, us as healthcare workers, sexual contacts of infected persons, persons with multiple sexual partners, and infants are born to moms that are infected. Most new infections are due to high-risk drug use, which is about 60%, or sexual behaviors. The incubation period for it is 5 to 9 weeks. It's transmitted through blood, mother to her unborn child, breastfeeding. It's asymptomatic or very slow to show symptoms. And as I said earlier, sometimes no symptoms until patients are diagnosed with liver cancer or cirrhosis. And once again, interferon's been used to slow the progress when the disease becomes chronic. And the prevention for it is the same as hepatitis B. So, it's going to be safe sex. It's going to be making sure that you have proper hygiene and sterilization techniques. And I know that a lot of you don't deal directly with sharps or sharp instruments in what medical field that you're in, but in dental hygiene, dealing with the instruments that are so sharp, all it takes is just, I always say, take your time, because trying to rush is when you're going to get speared with an instrument, because you're going to be grabbing instruments quickly, taking them out of an ultrasonic cleaner, trying to bag them. A lot of times you drop them down into the bag where you bag them, and the top instrument will just clip the tip of your finger. I mean, I've been speared many times in my lifetime, and so I would have to say to any of you that are using any sort of instruments, any sort of sharps, is to just take your time, because it you're trying to hurry for the next patient can cause some life-altering events for you. Okay, so the next virus we're going to talk about is rabies, also known as hydrophobia. It's a disease of animals, but it can be contracted. A human can contract it from an animal. The disease affects usually bats, skunks, foxes, raccoons, dogs, cats, and cattle, which I did not realize that cattle was involved in rabies until I was reading up and preparing these PowerPoints. But yes, cattle can be involved in it as well. Primarily, you're going to see bats and raccoons are going to be our primary carriers. Since the 1900s, the disease has increased dramatically due to bat and raccoon-associated rabies. The disease is communicated to humans through the bite of a rabid animal, and without treatment, it's always fatal. An estimated 30,000 deaths occur worldwide each year, which is just crazy to think that many people would die of rabies, because actually they die a really horrible death. But in the United States, we don't really have the issue of rabies, because, once again, of our public health system. The incubation period is usually 2 to 8 weeks. It has been known to be as little as 5 days, or as long as 1 year, or even longer. Dogs and cats are said to be communicable for 3 to 10 days before the onset of symptoms, and for as long as the disease lasts. There is no natural immunity for humans, so basically you're not going to be carrying any sort of an immunity to rabies. If you get bit, you're getting rabies. The number of animal deaths has almost doubled in the last few years from rabies, and individuals that work with animals, or people that like to hike and camp and spend time outside, they should know the procedure to follow if they're bitten by any animal, especially if it's an unprovoked bite. So, they also say that if you see a raccoon during the day, that the raccoon most likely has rabies, because it affects the brain, and the raccoon doesn't know not to come out during the day. So anytime you see a raccoon during the day, it's time to call the police department, health department, to come out and have them take it. And raccoons, they're just a dirty animal. So I know I've seen some things on Facebook where people have raccoons as their pets, and they are cute little animals, but they are mean as hell. They are really mean, and they are filthy dirty. So if you have any raccoons that come up close to your house, keep that in the back of your mind, that they are one of the highest carriers of rabies. And the transmission it occurs when saliva from the infected animal enters the muscle tissue through a bite or a scratch. If you see the third PowerPoint, no person to person, so you're not going to see an individual that has rabies give it to another person. But there have been cases of, and I remember specifically reading this in the newspaper, where a man got rabies, and he had a coronal implant from a corpse, and the person that died had rabies. They didn't know it. They took his cornea, implanted it into the next, to the recipient, and the individual got rabies. So that's one of the only ways that you would see the transmission from human to human. Since this has happened, individuals now are tested for rabies before they donate, before they will harvest any of their organs. And you might want to read up a little bit in the book and just see the route that the infection takes and how it affects the individual's brain. It's always fatal. If you've been bitten by an animal and it's suspected that the animal could have rabies, the wound should not be closed or sutured. So we want to keep that virus as close to the skin as possible until your rabies vaccinations are utilized on the individual. And there's several different vaccines that are used if someone's been bitten by a rabid animal, or even the possibility of an animal being rabid. The individual has to go through a series of vaccinations. And I told you earlier on that I have cats and 2 dogs. And my cousins, we all love cats, and we all have have had many cats in our time frame. And my cousin, who both of her daughters are doctors actually, she feeds outside cats as well. So she has like a little setup outside where she has heated, they're strays, they're not really her cats, but she feeds them. And she said every day this cat would come and she would feed him, and it would kind of like, intertwine in between her legs and want to get pet, and she never pet the cat. And she said the one day she went out and she fed the cat, and she said, I don't even know why I did it, but I reached down and I went to pet the cat's head, and she got bit by this cat. And so obviously she calls her daughter, and her daughter's like, well, you have to catch the cat. Well, the cat took off, and so she ended up going to our local emergency room, and it was kind of like a joke because they had no idea what to do with the possibility of someone who had been exposed to rabies. But as it turned out, she had to go through all the vaccinations, and the first vaccination was in her finger where she got bit, and she said she stood straight up. The pain was so intense from this vaccination, and her husband had to go through the same series of vaccinations because he had cleaned and washed the food dish where the cat had eaten, and the cat never came back. And it's funny because this was probably like 5 years ago, and my cousin was over at Christmas time, and she said, you will never believe that cat came back. And she saw the cat, it came to eat like 5 years later. So she probably didn't need the vaccination, but because they couldn't catch the cat to actually test it to see if it had rabies, she had to go through the whole series of rabies. So there's another thing I would throw out there, that do not touch any animals, even if they're domesticated animals, that you are not sure will not bite you, or that you would not get some sort of infection from it, because it can, once again, be life-altering for you, as my cousin Eileen found out. So in the United States, with our wonderful public health system that we have, all dogs and cats should be registered, licensed, and vaccinated against rabies. Stray cats and dogs should be impounded and destroyed or vaccinated. Once again, do not pet a stray cat or a stray dog because you just don't know. And I think, being the animal lover I am, when they say it should be impounded and destroyed or vaccinated, but I I think they could probably vaccinate and then put the dog up for adoption instead of destroying them. But there's so many areas, there's so many animals that just roam, and um, they're eating wild animals themselves to try and stay alive. So I could see where that comes into play. Any animals that act strange should be reported to the local police or health department. Do not touch, do not handle any animal that's acting strange. If an animal bites someone unprovoked, the animal should be caged and observed for 10 days. So if you ever see where an animal, the big talk about pit bulls there for a while being so vicious, and if they would bite or maul someone, the animal needs to be caged and observed for 10 days, and you need to provide documentation that the animal had his rabies vaccination. Any wild animal that bites somebody, they say it should be destroyed immediately, and then the skull should be kept, and it is kept on ice actually, and sent for testing to see if the rabies, because they'll check the brain to see if the animal has rabies in its brain. Okay, the next viral infection we're going to talk about is herpes simplex. Herpes simplex is a localized viral infection, so it is not going to be something that is systemic. There are two kinds of herpes simplex virus 1 and virus 2. Incubation period is anywhere from 2 to 12 days. Everyone is susceptible to herpes simplex. Most adults, 70 to 90%, have been exposed to herpes simplex virus 1 at some point in their life. Although visible symptoms occur in only 10%. Once the virus enters the body, it will always be there. About 60% of those infected, the virus will reactivate later in life. Herpes simplex virus 1 is usually found on the mouth, around the nose, in the commissures of the lip, the chin. The virus has been found in the saliva up to 7 weeks after the lesion heals. And genital herpes is herpes simplex virus 2, which is usually associated with the bottom part of the body. And it's infective for about 7 to 12 days. The saliva of the infected individuals or bisexual activities is how herpes simplex virus 1 is transmitted from one person to the other. Oral, genital, or oral anal contact will transmit herpes simplex virus 1 to make it herpes simplex virus 2. So if you're susceptible to what we call a cold sore, that's a herpes lesion, and you kiss somebody before, which we call the prodromal stage, during, or up to 7 weeks after, you can transmit that virus to your partner. And the same way with transmitting it to herpes simplex virus 2. It lives for a long time, even though it's not active, so you could be passing it on and not realize it. The prodromal symptoms, which are the symptoms that appear before the virus actually breaks out is a lot of people will say they have an itching or a tingling in the area where the lesion will break out. And then that can be, a couple days before the vesicles actually start to break out around the mouth, the genital, or the anal area. And once you have it, you have it. You're never getting rid of it. So that's one of the big sexually transmitted diseases that we really try and warn teenagers and young adults about unprotected sex. It can be very painful because it is on the nerve endings, and the individual will, you figure if you have a nerve ending that's kind of exposed, you can imagine how painful it would be. And it's a virus, so you can have a swollen lymph nodes with it in the surrounding area. You can have a fever, and for genital or herpes simplex virus 2, a very painful urination and bowel movements because of the lesions. The fluid-filled lesions will break open and begin to heal in about 1 to 3 weeks during the primary infection, which is the initial infection. The interval is shorter with reactivation of the disease. So if you're somebody who has a tendency to get cold sores, when you get your breakout, it's not going to last as long as the initial outbreak does. And most individuals that get cold sores are susceptible to having that reactivation in that same area. And a lot of people tend to touch that lesion when it breaks out. All that fluid is completely contagious. So when I did do dental hygiene and patients would come in with a lesion, even if it was scabbed over, we did not treat the patient because me working on that individual's mouth, touching that area, I could very easily touch somewhere else on the patient's face and spread the lesion. So herpes is super contagious, and if you are in the dental field and somebody has an active lesion or a scabbed over lesion, and even in the dental hygiene clinic at YSU, even when it's scabbed over and would peel down, we would still wait a couple more weeks before treating that patient because remember, it is active in saliva afterwards as well. You can spread herpes simplex to your eyes. It can go to encephalitis or meningitis if it ends up on nerve endings in the spine or the brain. You can get it on your fingers, which is called herpetic whitlow, and that was once again back in the day when we didn't wear gloves. A lot of dentists would end up with herpes on their finger because they would have their hands in the patient's mouth and maybe not realize that the patient had herpes. And remember, also, we didn't really know as much about the etiology of herpes as we do now. And basically the only treatment for it is an antipyretic. The big one that's used is acyclovir, which is it just basically reduces the virus shedding, so the virus will continue to multiply and shed, meaning the lesion can get bigger and bigger, and all this does really is just reduce how big the lesion is going to get. And a lot of times if you feel that lesion coming on, you take the acyclovir and you might not get much of a lesion at all. And I put in there good personal hygiene because the number one thing you don't want to do if you have a herpes lesion is you do not want to touch that. Remember, if you're touching it with your hand that could have some sort of a bacteria on it, you've got an open wound, now you've got a secondary infection in that lesion. I used to get so frustrated because patients would come in and they would say, "Oh, I know how to get rid of. Yeah, I just put bleach on it. Put bleach on a Q-tip and then I put the bleach on the lesion and it goes away." No, that doesn't. That might make them feel like they've done something, but it's not doing anything at all. What it's going to do is end up with a bigger scar. And believe it or not, and I don't know if you guys have ever heard anything like this, but I cannot tell you how many patients would say that they don't make fun of me here, but they would put urine on it, their own urine. They would urinate on a Q-tip and they would put their own urine on it, and that was their method to get rid of their herpes lesion or their cold sore. The best way to treat it is to recognize the signs and symptoms and start your acyclovir before the lesion breaks out. And it's the same with genital herpes as well. Patients that, of course, being in the dental office, no one's going to say, yeah, I have genital herpes, and that's information I didn't need to know anyhow. But it's the same thing. They need to be on an acyclovir. They need to reduce how much that spreads. And if you have had herpes simplex virus 2, you're going to spread that to your partner. A lot of times the individual, once again, does not have the signs or symptoms that they're going to break out, and they have unprotected sex and they give it to their partner. So that's male as well as female, and it can pass back and forth. Now this is a picture of a child. Usually the primary herpes outbreak is going to be severe. It's going to be, just like I said, it's going to last longer, it's going to be severe, it's going to be painful. This little guy, you can see how he's blistered, his lips are swollen, guaranteed he has all these lesions in his mouth, not just on the outside, but it will be, roof of his mouth, tongue. And the biggest problem here, think about it, what would you think the biggest problem would be with a child that looks like this, that is in pain, and their mouth is hurting them? What would you think the biggest problem is going to be? It's going to be dehydration and lack of nutrition, because the child's not going to eat and the child isn't going to drink. So this is where a lot of times kids do end up on IV fluids just to keep them hydrated until this starts to go down. But this is usually when you see, I've only seen one primary case, and it was on my girlfriend's daughter, and very interesting because she was probably about 3 when she got it, and it was very similar to this. It was all over on the inside of her mouth, but she's 27 and she's never had a secondary outbreak of a herpetic lesion, which, is kind of amazing. And this is herpetic, it's a herpes simplex virus 1, and it's called labialis, meaning on the lips, the labial of the lips, and you can kind of see these fluid-filled vesicles all around here. And once again, very painful. Here's another picture of herpes labialis, a little bit more of an outbreak, and this is not uncommon to see. This is not a primary outbreak, this is a secondary outbreak. And you can kind of see all these little vesicles. And remember, these vesicles can crawl all the way up to the nose too. Once again, this is herpes labialis, and it's not necessarily on the lips like you would think. It's on the cheek, and this could very easily have been from this patient. Might have had one on her lips at some point in time, rubbed it, touched over here on her face, and spread it. That's why we said that we don't touch patients that have a primary active lesion. This is herpes of the eye. You can see all around the lashes and underneath the lesions. Now, I worked with a girl that was a dental assistant, and she would get these outbreaks of herpes, and she said she originally had her initial outbreak on her eye. She was on the swim team, and they used to use goggles that were just goggles at her school, and she got them from the goggles. But she would get them all over her chin, her nose, her lips. It was very hard to look at, believe me. And she was embarrassed because here she is in the dental field, and she's got all this going on every now and then on her face. Here's herpes of the tongue. You can see the vesicles on the tip of the tongue, the edge of the tongue. Individuals that do carry the herpes simplex virus 1 virus, usually these outbreaks will be more prominent when you're run down, poor nutrition. And another thing that will bring them on is the sun. And an individual that is immunosuppressed or immunocompromised, such as an HIV patient, will be more susceptible to more recurrent outbreaks. And then this is herpetic Whitlow. You can see the lesions on his finger. Looks very painful, I'm sure it is. This is genital herpes, herpes simplex virus 2, obviously primary lesions. You can see they come up to the top. They probably come up into the pubic area as well. So, enough about herpes simplex virus 1 and 2. I think you have a pretty good grasp on that. So the next thing we're going to talk about, another viral infection, are warts. The etiology of warts is the human papillomavirus, HPV, and many females, or most females, should be having an HPV test every year when they have their annual exam and pap exam. They have been doing the HPV test as well, because if you are a carrier or you have been exposed to the human papillomavirus, that's the #1 cause of cervical cancer. So if you are a carrier, then you're going to be watched a little more close than the average person. And so we have several kinds of warts. Common warts usually occur on sites that are subject to injury. So that would be when you could bump your hand or your finger and the virus would enter. So it would be hands, face, knees, scalp. There are flat warts, which usually occur on wrists or the back of the hand. They're flesh colored and they're flat, so you really don't see them other than you feel like a little bump on the skin. And then there's another wart called a filiform wart, which appears more in overweight, middle-aged people, and they're long and slender, and you see them a lot on individuals' eyelids, their armpits, and their neck. Everyone's probably heard or had a plantar's wart at some point in their life. They're hard, horny, rough surfaced, and they're usually on the sole of the feet. And then there are genital warts, which are pink, and they're very much like a cauliflower. And as I have stated earlier, they're the most common cause of STDs and a leading cause of cervical cancer. And just to throw this in, as a dental hygienist, a lot of our oral cancers now have been isolated to the HPV virus. Some years ago, the actor Michael Douglas was diagnosed with throat cancer, and it was noted that it was from the HPV virus as well. So that's now we're in dentistry kind of localizing if an individual does have oral cancer, that is usually tested for HPV virus 2 before they treat it. The incubation period is usually 2 to 3 months, but it can be as short as 1 month or as long as 20 months. They are communicable as long as they're lesions. As long as there's something there, you can spread that to somebody else. Genital warts are more common in sexually active young adults. Once again, that's where your sexual education comes in. If you're a parent, you know, my bachelor's degree is in public health, and that is one thing I was never shy about. My son used to get so mad at me and embarrassed, but I was not shy at all about talking about infections and sexual absence or using protection, because a lot of these things, once you have them, they're not going anywhere for the rest of your life. So you need to definitely make sure you talk to your kids. They're caused by direct contact. No pain. A lot of people that end up with genital warts have absolutely no idea until one day they wipe themselves and they feel the warts. And the warts can be internal as well as external. For most general common warts, when the body builds up enough resistance to the actual virus, the warts will just like spontaneously disappear. They can use liquid nitrogen to freeze the wart, and that treatment is called cryotherapy or cryosurgery, and it just freezes it and it dies and falls off. And one thing, going back, and I'll just throw this in there about plantar warts, back a while ago, they used to cut in to like plantar warts. They would cut them out, and that was like the worst thing you could do, because when you cut into a virus, you spread it, and so they might get that one wart out, but the patient might end up with 5 more warts. So that's really not an option anymore, is to cut into warts. And here you can see pictures of plantar warts, and these are very painful because they're deep, and they will lay on, the flesh and the nerve of the foot. And you see these plantar warts come a lot from showering in public showers at the gym, walking around in bare feet. Like whenever I go to a hotel room, and please don't think I'm neurotic, because maybe I am a little bit, but whenever I go to a hotel room, I will not walk on any surface of the carpeting, bathroom, anything without having like flip-flops on, because I'm so neurotic about picking something like this up. This is kind of something you might want to put in the back of your head as well. Okay, and this is kind of an extensive case of common warts. And you can see they're probably on the palms of his hands as well. And this would definitely be a case that you would want to have those burned off before you would walk around with those. Okay, next we're going to talk about acquired immunodeficiency syndrome, also known as HIV or AIDS. And I want to be specific when I say that when when an individual tests positive, it's HIV. They are not considered an AIDS patient until there are certain T cells and B cells that are continually measured. Once those cells reach a particular level, the body is going into basically into failure, and there's not much immunity left, because remember we said those T cells and B cells are responsible for immunizing or giving us some immunity towards a disease, towards an antigen. Once those cells reach a particular point, and they call it wasting, actually, the individual will be considered having AIDS. An individual can live for many, many, many years just being HIV positive. And I think we've kind of all seen that with, is it Magic Johnson? He's lived probably 20 plus years. Obviously, he has probably the best treatment because he can afford the best treatment. Another person is Charlie Sheen, who came out in the past few years that he's HIV positive as well. And same thing with him. I mean, he probably is getting the best treatment, the best cocktails, and he'll probably, if he doesn't kill himself by his poor behavior beforehand, he'll probably live a completely normal life. And the ticket with HIV also is identifying it early enough so that they can start to provide you with an anti-viral medication to start building your immunity or keeping your immunity at a particular level. And transmission is through semen, vaginal fluids, or blood, and it must be introduced to an individual's bloodstream. Okay, so this isn't something that you're going to, kiss somebody that has HIV and get HIV from them, because it has been found in saliva. That was a big issue with Magic Johnson, that nobody wanted to play basketball against him because, you sweat on the court, and there's always that chance of, getting bumped and there being blood involved. But you're not going to get HIV by touching someone's blood unless you have an open sore and you touch that blood. So there was a lot of stigma that went on with HIV for a lot of years, and it all came from uneducation, and still uneducated people still have, and I don't mean uneducated meaning they didn't go to school, but they don't know enough about the disease to really recognize it's not an easy disease to acquire. Okay, it has to be blood on blood. It has been detected in saliva, tears, urine, and bronchial secretions. It can be spread from a mother that is infected to her infant. So you know how mother's blood passes, through the placenta to the baby. Obviously, that's blood on blood. The baby, there's a good chance the baby will be born with HIV. HIV can lay dormant up to 10 years with no symptoms. I've even heard that it can lay dormant up to 20 years with no symptoms. And some people never develop symptoms, never know they even have it. And like I said earlier, when we were talking about me being in the dental field early on, we treated patients with HIV different. That they were treated different because we didn't know enough about the disease um, to recognize that by me cleaning that individual's teeth, I'm not going to get HIV. And they had come out with a law stating that you cannot deny a patient treatment based on the fact that they have HIV. So if you use universal precautions in however you treat a patient, you don't have to worry about contracting one of these diseases. When I worked at the prison, that was my last clinical dental hygiene job. They tested everybody that came in to prison for hepatitis B, C, and HIV. And, obviously I had their medical and their dental chart when I would see them. And they were allowed more frequent cleanings than the average inmate. And they also were we had a special recall list where they, by law, had to be seen. I want to say it was either every 3 months or every 6 months. They had to have just an oral exam, not a cleaning, but just an oral exam, just to make sure that there were no oral issues that were developing from the HIV. And I never thought twice about treating a patient with any of the diseases. Basically, like I said, I was very conscientious. I took my time, and that was one nice thing about the prison. I had time with more time than you would have in an average practice, because we had to allow for the inmate to be brought down, or the inmate to be brought over to have their teeth cleaned. So they did allow us more time, and I never thought twice about it. But I also had to think, okay, we tested all these people before they came into the prison, but a lot of these people are all, they're having sexual relations with each other in prison, and there's a lot of rape that goes on in prison. So even though they may have been tested negative when they first came in, I'm sure quite a few of them had HIV and didn't know it. But like I said, universal precautions, not an issue to treat them. Soon after, say the person was contaminated with HIV, they get, a lot of them, not necessarily all of them, they'll get some non-specific symptoms, like anywhere from 6 days to 6 weeks after when the virus has entered their body. They'll get some swollen lymph nodes. It may be like flu-like symptoms where they just don't really feel great, like they might be coming down with something, but then that goes away. And that's how come they don't know that they have HIV. I didn't go into a whole lot of depth with HIV because I know we have learned about it in so many different classes. The book does go into a lot of detail about HIV. It gives you a lot of statistics, a lot of statistics as to different parts of the country where it's most common, where you see it more, so on and so forth. I would suggest going ahead and reading it just for your own interest, basically. I'm not going to hold you responsible to much more than this on HIV for your test. So much more than what I have lectured and what I have put in the PowerPoint. So, because remember I told you, take notes, because I do say I try and prepare these as if I would be lecturing to you in a classroom. So take notes to add to your PowerPoints, because whatever I talk about is kind of free game on our exams. HIV, there is no cure. They've been working on a vaccine for years and years, but because of how it replicates itself, the virus, it isn't like one virus that looks the same and that they can make a vaccine for, it replicates itself and it changes. So from one person to the next, it changes. So it's very difficult to actually come up with a vaccination. Drugs to fight the disease, yes, we have those. Any antiviral, like we said, is going to slow the spread and the shedding of the disease, and also reduce the risk of the opportunistic diseases that are associated with HIV, like we said, the herpes simplex virus, shingles. In the book, it talks a lot about Kaposi sarcoma. That you don't see people with Kaposi sarcoma hardly at all unless they're an HIV patient. So what the drugs actually do are try and reduce those diseases, because pneumonia is another one, which is where we first started recognizing that there was this weird disease out there in the early 80s, was a particular type of pneumonia that they were coming down with. So we want to keep the patient healthy. The first drug is a reverse transcriptase inhibitor, which is RT, and AZT. That was the first drug that we saw out on the market. And then we have the protease inhibitors, which interrupt the replication in the later stages of the virus cycle. And that's kind of what I said. We want to reduce that shedding and replicating, and as that continues, then the disease progresses. Continuing on with the treatment, they do have a combination of drug therapy called HAART, meaning highly active antiretroviral therapy, and a lot of patients are that are in a little bit further stages of HIV will go on HAART, and once again prevents the replication. And the best treatment really for prevention is education, and once again that goes back to talking to your child, recognizing IV drug use, seeing that these individuals get treatment, unprotected sex. There was a period of time where areas that were so high with HIV that they were passing out clean needles, so people didn't share needles when they were using their IV drugs. Passing out condoms so that they weren't having unprotected sex. So education is going to be your biggest fight in the fight against HIV. Okay, so that does it for that chapter. And I hope you got something out of it. I find this stuff so interesting. I hope you guys have too.